Sorry. So I would use this title, Perspectives of the New Chinese Hypertension Guidelines, because the new guidelines are still under review. We hope that we can publish these new guidelines in the next few months. If you look at the journey of the Chinese Hypertension Guidelines, you see we started in 1999. We published the first Chinese Hypertension Guidelines as a booklet. And later on, we updated this guideline in 2004 and 2010, and recently 2018, and published in several Chinese journals. And for the recent 2018 one, we also published a Chinese version in the Journal of Geriatric Cardiology. So we are now updating the Chinese Hypertension Guidelines. We actually plan to publish it in 2023, but it was delayed a little bit. We believe we should publish this very important document this year. So if we look at the management of hypertension in the past about 30 years, you see we have seen a very substantial increase in the prevalence of hypertension. In the meantime, we also have improved the management of hypertension. See, the awareness, treatment, and control rates of hypertension increased substantially, especially the control rate from only 2.8% to the current 15.3%. But of course, it was still very low because many of them have not yet treated or controlled to the target level. Now we are updating the Chinese Hypertension Guidelines. We should still remember the history of hypertension in China. If we look at the past 50 years, you see a very substantial increase in the prevalence in parallel with the increase in life expectancy. So it means that the increased prevalence of hypertension was to a large extent a consequence of aging in this very big populous country. And then if we look at the age-specific prevalence of hypertension from 15 to more than 80 years, you see in all age groups, the prevalence of hypertension increased. But the increase was much greater in middle-aged and young people. So it means that in addition to aging and lifestyle changes probably also played an important role in the increase of hypertension prevalence from 1991 to 2012. And then if we compare the management of hypertension across so many Asian countries, you see that we have two worlds in these Asian countries. In some countries and regions, for instance, Korea, they have quite a high control rate of hypertension. But if we look at many others, the control rate remains at a very low level. So in most of the Asian countries, we face a big challenge of hypertension control. So we all have to work hard to improve the management of hypertension and increase the control rate of this very important chronic disease. Then if we come back to Chinese Hypertension Guidelines, you see in 2018 Chinese Hypertension Guidelines, we continue to diagnose hypertension according to a clinic blood pressure of 140 systolic and 90 diastolic. So it means that after the change in the United States hypertension guidelines for the diagnosis of hypertension from 140 over 90 to 130 over 80, we continued to use this 140 over 90 criteria for the diagnosis of hypertension. But if we compare these two different criteria for the diagnosis of hypertension, actually the difference was not really huge. That the data I showed in a commentary on the American guidelines published in Circulation in 2018. And the second question, or the second most important question, is about blood pressure classification. And if we look at the American and some other hypertension guidelines, they also changed a little bit of blood pressure classification, and they often ignored the very severe hypertension. For instance, here we still define grade 3 hypertension as 180 over 110 systolic and diastolic blood pressure for the definition of this very severe grade 3 hypertension. Why we still define grade 3 hypertension? If you look at the prevalence data, that explains the situation in China. You see, we still have a lot of patients with this grade 3 hypertension, 180 over 110 millimeter of mercury or higher. So it means that we still have a very large patient population with grade 3 hypertension. We still need to define this clinical situation and to manage this severe hypertension. And in the 2018 Chinese hypertension guidelines, we also recommended the use of ambulatory and home blood pressure monitoring for the diagnosis of hypertension according to various diagnostic criteria. Here you see the values for ambulatory and home blood pressure monitoring. In the new Chinese hypertension guidelines, we will continue to define hypertension according to 140 over 90 millimeter of mercury and continue for the classification of grade 1, 2, and 3. And for blood pressure management, but we expanded from the previous clinic, home, and ambulatory blood pressure measurement to a much wider scope. You see here we listed kiosk blood pressure measurement, screening blood pressure, wearable blood pressure measurement, fall-in blood pressure measurement, and even central aortic blood pressure measurement. So what we want is to utilize all these blood pressure measuring technologies to improve blood pressure management. And here you see the so-called automated office blood pressure measurements. We want to establish this digital blood pressure measuring platform for clinic blood pressure measurement, so patients can measure blood pressure themselves, and doctors and physicians can discuss the diagnosis and treatment of hypertension with these blood pressure values. And we are also promoting the use of a digital platform supported or web-based ambient blood pressure measurements. Here you see the graph of 24-hour blood pressure and values for the diagnosis of hypertension. And similarly, we also promote the use of home blood pressure monitoring on the basis of digital platforms. So you see, we have this 7-day blood pressure measurement in the morning and in the evening. With all these values, we can improve the diagnosis of hypertension. And in the 2018 Chinese hypertension guidelines, we have this scheme for risk stratification. And you see on the horizontal axis, you have various blood pressure categories. On the vertical axis, you have risk factors, target organ damage, and cardiovascular complications, plus diabetes mellitus. So with all these uh, variables, uh, we can stratify the cardiovascular risk of hypertensive patients into low, medium, high, and very high levels. In the new Chinese hypertension guidelines, we probably will change a little bit, but not that much. What we want is to add disease severity. We all know that with risk factors, actually, it's a probability of risk, either low, moderate, high, or very high. It's a probability for the future. What we want is to look at organ damages and cardiovascular complications. So it means the current clinical situation on all those organs instead of probability of cardiovascular event. So here you see, and we classify disease severity into stage 1 to 3. So stage 1 with risk factors, but without organ damage, stage 2 with organ damage, and stage 3 with uncompensated, or in other words, symptomatic cardiovascular complications. So in this new scheme for risk stratification, we hope we can better treat patients with hypertension. And in the 2018 hypertension guidelines, blood pressure should be treated to 140/90 or below in all patients, in all younger patients, and then if possible and if tolerable, and if the risk is high, to a 130/80 or below. And here we have two older age groups. The younger older age group, 65 to 79. So we propose 150/90, or if tolerable, 140/90. For those over 80 years, we propose less intensive target of blood pressure control, 150/90 millimeter of mercury. In the 2018 hypertension guidelines for the choice of first-line agents, we have these 5 classes of hypertensive drugs, but in the new hypertension guidelines, we probably will recommend ANI, the so-called angiotensin receptor and neprilysin inhibitor for the treatment of hypertension, because this drug has been approved for the treatment of hypertension and has been used for hypertension management since a few years. And then probably we also recommend the use of these drugs for the treatment of hypertension in the future. And in the 2018 hypertension guidelines, we also have a very strong recommendation on the use of combination therapy, especially those with stage 2 hypertension or more severe, and in those patients with high cardiovascular risk. And in the Chinese hypertension guidelines, in the old ones and the new ones, we probably would propose more preferred combination approach. Here you see in 2018 hypertension guidelines, we already proposed the calcitonin blocker plus thiazide or beta blocker as a preferred combination. And then in new hypertension guidelines, we would also include ANI as a component of preferred combination therapy with a calcium channel blocker or thyroid diuretic. And in the new Chinese hypertension guidelines, we would also have recommendations on the use of device therapy, particularly renal denervation. So you see the descriptions on the recommendations for renal denervation. And here we actually recommended the use of renal denervation for two groups of patients. First, those with resistant hypertension, and second, with difficult to treat hypertension because of either high risk or with poor treatment adherence. So it means that if this technique would be approved in China, we probably would use this new therapy in some of our patients with resistant hypertension or difficult to treat hypertension. And finally, I would conclude my presentation with this slide. A few years ago, we set up this goal of blood pressure control in China. So what we want to do is to improve the blood pressure control in China to a level of 50% of control rate of hypertension. So the two major factors are awareness and treatment and control. So what we want is to have 70% of awareness and treatment and 70% of treatment and control rate. So with this 270% rate, so we can achieve 50% of control rate of hypertension in China. So thank you very much. We hope we can improve the management of hypertension in China and in a large area in Asia. Thank you.